جميعا. Okay. So حابدأ أتكلم معاكم. I'm gonna speak in English. Please, if you have any questions, I want this to be interactive, presentation. Yet maybe you can ask at the end of the lecture. So we're talking about plastic surgery for medical students. I know as medical students, maybe you guys are not getting that much of exposure to plastic surgery during your medical school, and it's just part of the surgical block if you are in block system, or it's a part of the surgical semester that you have. So what is plastic surgery? Disclosures, I work for a private practice, no disclosures, and I'm not trying to convince you guys to go to plastic surgery, nor not to go to plastic surgery. Okay, so this is going back. So what is plastic surgery? Plastic surgery is a surgical specialty involving the restoration, reconstruction, and or alternation of the human body. And this is the definition that I found in Wikipedia, and it's the simplest. So I want you to imagine that plastic surgery was a specialty that is relatively new. Relatively new in terms of that it's the essence and the basics, and to have it as a specialty is new. But if we're talking about the trials of plastic surgery or to modify the alteration of the human body was there 16,000 before Christ. So they found evidence and like the Egyptian old books that someone tried to improve the aesthetic of the nose of someone, and there is huge history of that. But in the new era, what happened is that with the wars that's happening, World War II, World War I, the surgeons who are in the specialties like ENT, general surgery, orthopedics, they started to have those casualties who came back from war, and those people had issues. These issues were either functional, like they couldn't move a part of their body, they couldn't close their eyes, they couldn't walk properly, or it could be aesthetic. They look, they had an explosion and their face looks mutilated, or there is a damage and injury. So those people started to take these steps of saying, okay, how can we help these people? How can we improve it? So we're always thinking, how can we restore the function, and then how we can restore the aesthetic appealing of the human body. So our mission is to restore the function followed by the aesthetic. So as a plastic surgeon, whenever I have a patient in my clinic, whether it's a burn patient or a patient who's been having an accident, and I look at him or at her and I say, okay, how can I restore the function? I test the function. If the function is okay, can I do anything to improve the aesthetic? And then this is how we work. So those people, the first generation of surgeon, they were the people who put the footsteps of plastic surgery. And that's why the specialty that sometimes they call it surgeons of the surgeons, because it came from surgeons in different specialty. And that's why there is a huge overlap between plastic surgery and different other specialty in the surgical field. So what are the subspecialty? You will find a lot of subspecialty, but the main are the craniofacial surgery, whether it's a pediatric or adults. We have the burn surgery, anything that's related to burn, hand surgery, anything from wrist onward, including bones, tendons, nerves, infection in the hand, that's part of plastic surgery, breast surgery, reconstruction, and we're going to talk about cosmetic microsurgery. This is where, for an example, if somebody comes and they have a huge wound that is exposed and we cannot close it, the other surgeons from different specialty, they have a problem with it, they call us and we can do something called flap, which is taking a muscle from different parts of the body and put it in that area. And we have the aesthetic surgery. Now, maybe as a medical students and people who are in the general population, aesthetic surgery is the most famous because it's the attraction of the media and people see that, but it's just part of plastic surgery. So as we know, that plastic surgery is a surgical specialty. It has an extensive training. If you are finishing your medical degree right now, you will have to go to a residency program. We have two residency program systems. In Saudi, we have one, and mostly in Europe, it's one, but in US, they have two. So it's a 6-year program, and they call it integrated because you go to plastic surgery since you finished your MD. In US, there is Another option where you can do general surgery, then do a fellowship of 3 years of plastic surgery. So it has multiple subspecialty and it mixes art and science. So why would you choose a plastic surgery? Honestly, this is a question that you have to think about it a lot. As a medical student, you might be asking yourself, am I a surgical person or am I a medical person? Now, what medical people likes, they like to think about things, they like to use the brain, they like to look about the physiology. Surgeons do that as well, but they like to use their hands, they like to use their skills, they like to see fast results. Like a surgeon, if he has a patient that stays in the ward for a month, then it has to be something very complicated or a burn patient. It's not the usual for us. But in a medical field, it's more like this could be the norm in terms of situation like infectious disease or stuff like that. You have to have the passion. So are you first a medical person or you're a surgical person? Let's say you don't know. If you don't know, you have to explore that through your medical years and through your internship. Take electives. See, are you a medical person or a surgical person? Do you feel more happy when you're doing surgeries and using your skills? You feel more happy when you are rounding with medical team and talking about concepts and treatment that is given by medication or other minor intervention? Are you passionate about plastic surgery? We see that a lot of people, they approach me as students and they ask plastic surgery because of the marketing that is happening for plastic surgery. Oh, I'm going to be famous, or I'm going to be treating celebrities, or I'm going to be doing this or not. That's not the way you think about it. You have to be extremely passionate about the whole specialty. And to do that is by taking, again, elective reading in plastic surgery, understanding if this is something you want to be in or not. The other thing, and the most important thing, is the goals. As medical students, before choosing your specialty, I want you to always think of your future. Don't think about only just the residency. Think about what after the residency. Am I a person that wants to have a work-life balance? Do I want to have more time with my family? Do I want to have more money? Is the specialty I'm going in the future, is it going to be there, or is it going to be taken off by artificial intelligence or more advanced technologies in the medical field? So this is something very important. I used to tell my interns that, okay, bring a paper, put what is your specialty, what is your personality, and then, okay, how much time do you want in your life as a resident and as a consultant? Like after you finish your residency program, how much money you want, how much passion do you have for the specialty that you're confused between, and vice versa. So how to match into plastic surgery residency? Now, to have the honest answer of this, I want you to go and ask the most recent fresh acceptees in plastic surgery. So go to the R1s in the program, R2s, and ask them what exactly is changing. Because, for an example, I'm going to talk about the things that I'm sure that they're still there. The GPA, the highest GPA, it's a very highly competitive specialty. Number one in the world, maybe in the US, I think even in Saudi Arabia when it comes into competitiveness. SLME, the Saudi Licensing Medical Exam, get the highest mark that you can get. Your CV, including electives, courses, researches, lectures, volunteering in different areas, and experiences that you had in plastic surgery. Now, when I was applying for plastic surgery residency program, we had a selection exam. We had an actual exam about plastic surgery, and that mark was put as part of the selection criteria for plastic surgery. So I am honestly not updated about the latest, but these are the basics, and you can always double check with the freshly accepted. So reach your goals, make sure that plastic surgery is a specialty that you're passionate about. You know in and outs what is ahead of you. You cannot be prepared enough. You can talk to a lot of people and ask them about plastic surgery, their experiences in the residency program. Everyone has a different experience. Some has extremely tough experience in plastic surgery, some have a milder experience, but it is a tough like specialty in general, because the knowledge is huge. The skills that you have to have is there, and even the years is long. Like if you compare family medicine, for an example, I believe that it became now 3 years in comparison to 6 years of plastic surgery. So you, by finishing a program in plastic surgery, you could have been a consultant in family medicine. Future opportunities: if you finish your residency program, you can work in a governmental hospital, whether it's a university-based hospital or Ministry of Health, and this might be changing in your era, because you know that privatization is happening now in Saudi Arabia. So honestly, I don't know how this is going to happen, but till now we have governmental hospital that is either from a military background or a Ministry of Health or a university. You could have a private hospital, and private hospitals are now getting more they're becoming more common, and even with privatization, mostly all hospitals might become private hospitals. You could have private clinics. It's either a group practice, which means like multi-surgeons that are working together, which is, I am in one of those, or you could have a solo practice. You're a surgeon, you have your own clinic, and you do your surgery in hospitals that is in private or a day surgery centers. You could be a researcher, and you can do all these together. You can be a surgeon and a researcher and working in different areas. And with the future that we are seeing in the field of plastic surgery, technology is like a lot of plastic surgeons around the world are actually inventors. They invent the tools, they invent like materials that we can use in our surgeries, and a lot of them are actually creating the future. So that's also an opportunity for you. So my tips for you: first of all, understand who you are. Are you a surgical person? Are you a medical person? Do you want to actually do residency program? You want to do something else? Not just because you're doing a medical degree, you have to go to a specialty and it has to be a surgical and it has to be tough. Understand who you are and be extremely honest with yourself. There is no shame in knowing, okay, this is for me, this is not for me. Choose your own specialty. And to know more and more, you will have to take elective. And that's what I said, test it. If you are confused between emergency and plastic surgery, take elective in emergency, take elective in plastic surgery. You're confused about any specialties, take electives as much as you can. Go ask the people, look at them, tell them how is their life, how is their experiences. Ask the juniors, ask the seniors, ask those who are consultant and they already made it. Ask everyone, gather information as much as you can. The more you're prepared, the more you're mentally prepared to like face whatever challenges you're gonna have in the future. Check what is your purpose in your life. Like, do you want, I was approached like a couple of weeks ago by someone, and he was telling me like, doctor, I feel like I want to work in cosmetic surgery, and I'm thinking whether to go ENT and do facial plastic or plastic surgery and to do facial plastic. For me, going through residency, just because you're going to something very far away and that you don't know exactly if you want it or not, does that serve your purpose? Does it worth to go into a residency that is very tough residency and to have 6 years of practicing just to reach something that you can reach by doing something else? So that's one of the questions you have to ask yourself like over and over again. Find a mentor. A mentor who is someone who is more experienced than you, even if he's not like much older, but there are people who can look at you and can ask you questions, and they don't make decision for you, but they are helping you to make a decision that fits your own life and your own goals. So a good mentor is important. Now, work on your social intelligence. Now, this is something is like a common sense. Be social intelligent. We reach a point now where we're talking about emotional intelligence. Understand the difference between them. Be a very good doctor, be a good communicator. If you heard about the CanMed, be a scholar, be a manager, be a health provider, and understand that being a surgeon, you're being a doctor first, and then a surgeon, and then a plastic surgeon. Apply everywhere. There is one of the criteria that we're talking about, whether to get a residency in a local program or abroad. Apply everywhere, because you never know where you're going to get accepted. Saudi program at one point was extremely competitive. I'm sure that now it's more extremely competitive, and chances in other countries, Each country has its own tests, exams, and their own challenges. Understand all of those. As Prof. Gattan once told us, like, your purpose now, if you decide to be a plastic surgeon, is to become a plastic surgeon as soon as possible. So this is an advice for you. And keep going. If you didn't get accepted in the first year and you really want this specialty, you're passionate about it, keep trying here and there and everywhere. And again, ask questions. Don't hesitate to ask questions. Nobody is going to say, oh, please don't ask me, I'm fed up with your questions. And that's it. Thank you.
يعطيك ألف عافية دكتور، صراحة النصائح كانت مرة مثرية وشكرا على your tips. في كذا couple of questions وصلتنا. A person asked if there is any private hospital that they can apply for a residency training, or does it have to be in a governmental hospital?
I think it depends on the city and on the program. As far as I know now in Jeddah, we don't have a private hospital that is offering. So the first thing, you need to be accepted in the council, the Saudi Council of Health. Once you're accepted in that, you will look for a sponsorship, but you cannot look for a sponsorship without being accepted in the Health Council of Saudi Health Council.
Okay, shukran, Diksa. Kaman, there is another question. Is there a demand for pediatric plastic surgery and craniofacial surgery in Saudi Arabia? So what are your thoughts and opinions?
Yes, all plastic surgery subspecialty are highly in demand. Now, again, I'm talking about the current situation. I don't know when you guys are graduating from your residency program, but overall, we still need a lot of plastic surgeons.
Great, thank you. Also, there is a question about the difference between the hand surgery fellowship as part of plastic surgery and or versus orthopedic surgery in terms of practice.
Okay, so the fellowship, it's united. It's the same fellowship, and the capability of doing surgery to repair the hands or reconstruct the hands are the same. But at the orthopedic, like for example, if you're in a general hospital and you're an orthopedic surgeon, subspecialized in hand, you're working hand surgery and doing other orthopedic, general orthopedics. While you're, as a plastic surgeon, you're doing hand surgery and other plastic surgery, general plastic surgery. So in terms of the fellowship, they're all the same. The same programs, actually.
Oh, perfect. Thank you. We have also another question on the comparison between in comparison to general surgery. Is plastic surgery considered a more flexible or has more flexible lifestyle?
It depends where you go. For an example, now if in residency program, they're all tough. They're all needs a lot of work, and it's challenging. But let's say now, if you graduated and you're working in private practice, you could say, as a plastic surgeon, I'm only going to do blepharoplasty, which is removing the excess skin in the upper eyelid. And you're famous for that, and you only want to do that, that's something you can do. And the same thing, if you're saying, I'm a general surgeon, I only want to do a appendectomy. I'm not going to specialize in anything but doing appendectomy. Can I do that? Yes, you can, but you will have to market yourself, and you will have to have your own practice to do that. But you cannot go to a general hospital and say, oh, I'm only going to do this, or I'm only going to do that. For example, if you're in a general hospital as a plastic surgeon and you have a burn unit, you will have to work burn, you will have to work hand surgery, you will have to work in anything that is related to plastic surgery. You cannot say, I'm not going to do this or I'm not going to do that. But in your private practice as a general surgeon or a plastic surgeon, you can choose. And the challenge there is going to be how to market yourself to be a very specialized in that domain.
Okay, doctor. So if I understood you correctly, so you have to do everything that you learned as a general plastic surgeon consultant, in addition to your area of subspecialization.
If you're working in a general hospital, yes.
All right, thank you. Kaman, there is another question about the difference between residency here in Saudi Arabia and abroad, particularly the United States versus Canada versus Europe.
Okay. In terms of acceptance, or in terms of practice, or do you want us to talk about it in general?
I think it's more of a general overview, and the difference, I believe, in training. إذا ممكن غيدة بس توضحي لي السؤال.
Okay. طيب خلينا نتكلم in general. So any program in the world has its ups and downs, even between cities. Like if you're in Jeddah, you will face more cases of this and less cases of that. If you're in Riyadh, your job as a resident is to be as strong as possible in the domain that you are going to be tested on and the domains that you're working on. For an example, let's say you're an administrator in a university that has a hospital and department of plastic surgery that does multiple, they have a burn unit and they do hand surgery and they do a lot of other things. And you know for sure that after finishing the residency, you're going to come back to this place and work as a consultant in plastic surgery. It is very smart to be strong in all these domains that you're going to work on. The thing that we find that sometimes people who are going to, especially the European programs, they're very strong in some areas and they're very, very weak in other areas. Now, if I'm going to compare the program between the Saudi program and the Canadian program and the American program, they're very close to each other. I'm sure you might heard most of the consultants who actually started the program in Saudi Arabia, they're Canadian graduates. So it was set and like it was planned to be mimicking the Canadian system. So we have a huge exposure in hand surgery, burns, microsurgery, cosmetics, and everything else. Now, if you went, let's say, for a residency program in a place where they don't have a burn unit and you know nothing about burns, and sometimes some American programs are like that. They don't have a burn unit in the center there. They're doing the residency in. It's your responsibility to say to your program director, I would like to improve my skills and knowledge and burns. I would like to take, for example, one elective of 3 months in a burn unit in whatever place that is close to you. Same thing if you're in France and you're doing a lot of reconstructive breast surgery, but you're not doing burn, you're not doing hand, you're not doing craniofacial. It's your job to ask for that elective to go and do it.
Thank you, Doctor. Kaman, there's another question about how to get a scholarship after the acceptance in the هيئة التخصصات الصحية.
طيب. I would advise you to ask the people who are recently accepted, but in general, at least when the time we were doing that. So the Saudi Council will accept, for example, let's say 11 candidates. Those 11 candidates will have to have a sponsor. Usually the sponsor, the hospitals are offering the same amount of numbers that the Saudi Council are offering. So you would find like 3 in King Faisal Specialist Hospital, 3 in National Guard and universities and etc. So what you do is you always first, as we mentioned before, work on your CV, work on your GPA now since you're medical students, and work on your SLME. Once you hear that they started accepting the positions, apply, whether it's a hospital or whether it's the Saudi Council. Now, in my experience, some hospitals started accepting the files of the graduate before the Saudi Council, and sometimes thereafter the results of Saudi Council comes out. So I'm not sure if that changed now or not.
Okay, thank you. Doctor, regarding the previous question on the local versus abroad training programs, Ghada who asked the question meant in which program is easier to get in? And also when they finish and come back, is there a difference between a graduate of the Saudi program or the Canadian program?
Okay, so once you come back, now the acceptance, it depends on the year. Like I'm always saying, you're competing with the highest graduate in your cohort or in your batch. For example, let's say there is 5 positions in anywhere, like in US and Saudi and Canada, and then you finished. You have, if you are the highest GPA, highest SLME or USMLE or the Canadian exam, and you are the one who got the highest in your interview and your CV, then you're going to be accepted. Now, a simple example, when I got accepted in the Saudi program plastic surgery, I think the competition was about 110 and they accepted 11. one of the years that is after me, that like one of the program directors was talking, there was 700 people applying for 11 positions. So they will take the best out of these 700. Some people are lucky to be the highest marks in that year, or nobody. Some people do not apply for the position because they think, oh, it's not going to happen. So do your best, apply everywhere, and God knows, inshallah, you get accepted all.
Ya Rab. Okay, so I think we have the last question. It's regarding getting accepted in a Canadian program, specifically University of Toronto, or should they consider another program in Canada in terms of them taking electives to get accepted there?
I'll repeat myself here and I say apply everywhere, get elective as much as you can. I did an elective in Toronto, I did an elective in Miguel, I did 3 electives in Jeddah and Riyadh. And once I got accepted in the Saudi program, I was happy and content, and I said, okay, that's it. Now, some people, they didn't get accepted in Saudi program. They applied in the Canadian, they got accepted there. The next year, some did not get accepted for 3 years in the Saudi program, then applied in France and they got accepted. So just be aware that this is a challenging experience and apply everywhere. Don't say, oh, I'm gonna only apply to Toronto. But what if Toronto did not happen? Are you gonna just look and stay? You just apply everywhere. Apply to the Saudi program, do your homework for the Saudi program. The cool thing about about plastic surgery, if you are doing electives in here and there, it's not only giving you information about that place, it's giving you information about the whole specialty, and it's gonna, and who knows, maybe after the elective you say, this is not for me. And please be extremely honest with yourself. Like whenever a medical student asks me, Doctor, should I go for National Guard or should I go for King Khalid University Hospital, or go to the toughest place, to the nightmare. So know what is the worst so you can handle the good. If you have a chance to go to Canadian universities, do that. It's going to help you. It's going to expand your horizon. You can compare for yourself. When I left from before, I'm a graduate of the same university of yours. Actually, I'm the first plastic surgery resident to be graduate from King Saud bin Abdulaziz Health Sciences University and get accepted in the local program. I was proud of that.
ما شاء الله دكتور يحتاج نخلي لك
اي المفروض
والله
stream 2. So yeah, so when I finished my I was in National Guard and did my electives there, and the professor there were amazing. So once I left to Toronto, I started comparing, okay, back in National Guard you used to have this and this and this and that, and there is good things that is happening there. Oh, in Toronto, this is what's happening. I went to Miguel. Oh, in Miguel, this is what's happening. So you start adjust what you're seeing based on what do you want. يعني مثلا, if you're a female and you have family and kids, and going to Canada is going to be something that is not going to be very feasible for you, then it's not feasible for you. It's you. It's nobody else. So whatever I say now, it's just my opinion. It's your life, it's your dream, it's your goals.
شكرا جزيلا دكتور. Since you pointed out that certain programs in the States offer a 3-year fellowship in plastic surgery after completing a GS residency, we received a question about the differences in practice after obtaining the fellowship following GS training. So can you just tell us, please, about the differences between a plastic surgeon and a GS graduating surgeon?
Okay. So if I'm going to think of, if I'm going to say now, let's measure the same thing to medical school. In US, you have to do pre-med, then you have to do medicine, right? But here in Saudi, you go to medicine directly. If I tell you what is the difference between both, can you tell me? Nobody can know, because there they might do psychology or applied medical science and then do medicine. It's the same thing. Now here, from my personal perspective, I wouldn't like to go to general surgery and do the whole residency of general surgery, then only have 3 years. I would like to have the exposure of being in plastic surgery since day one, but that's me. So whatever helps you at the end of the day to reach your goal. Now, bear in mind, US could be one of the toughest competition when it comes to surgical field, because first, you're not American, unless you are an American and you did your degree in the US, but you're not an American, you are an international graduate, and you will have to do very well in your USMLEs, and then you will have to apply for plastic surgery. So I would not discourage you from trying that road, and again, do apply everywhere, but it's not the favorable one for me. And the least favorable, if I'm in your shoe, it will be going to general surgery, then going to fellowship of plastic surgery. But do they know what to do afterward? Yeah, yani, there will come a point in your life where if I'm not trained or I'm not comfortable with doing this surgery or that, you should not do it. And that's like the simple honesty and ethical thing to do.
شكرا دكتور. كمان the same person who asked about the electives in University of Toronto is saying that they're a medical student and they already took an elective in a center they're interested in Saudi Arabia. So they're asking you if you recommend them to take an elective in another center or in the same center since they're interested in it particularly. And I believe you answered.
To take the elective
and in a different center here in Saudi to increase their exposure, or focus mainly on the center they trained in or took the elective in and do it again?
I would advise to go to different areas. Bear in mind, the Saudi program is a conjoined program, so you're shifting every 4 months or 3 months, depending on the current status. So if you get exposure here and there, it's gonna a little bit widen your horizon. You're gonna see different things, and you're gonna make also relationships. Who knows? You might find your mentor in the other university or the other hospital.
Yeah, absolutely. شكرا دكتور، صراحة أجوبتك مرة مثرية وانبسطنا إن درينا إنك you're a graduate من حرس stream 2 كمان. I think now we reached the end of the questions. إذا في أي شيء حاب we have one now. I think خلاص this is going to be the last. إذا لو وقتك يسمح دكتور.
Okay.
So would you recommend going to Europe for residency, specifically Germany or France?
If I have to choose between two, مشكلة هذا political question يعني I don't want to.
It's recorded.
Yeah. But again, let's go back to the first. Please apply everywhere. Now, if I say, okay, don't apply in France and don't apply in Germany, and you didn't get accepted in France, what are you going to do? If you didn't apply for the Saudi program, apply everywhere. Yani, okay, let's talk about advices. You guys, mashallah alaikum, you have done this plastic surgery interest club, and I highly salute you for your efforts and of spreading awareness and helping the specialty. So let's say you're a couple of people who are interested. Sit together, say, okay, what do we need for the Saudi program? We need to do 1, 2, 3, 4. Do that. What do we need to do for France? We need to do 1, 2, 3, 4. Do that. Germany, Canadian, US, and apply everywhere. That's as simple as that. When you get accepted, like let's say you get accepted in the Saudi program and the French program and the Canadian program, even at that time, calculate your goals. Does that help me? What is the benefit of this? What is the benefit of that? We assume that it's just the school. It's not just the school. It's the whole experience. Like if you went to France, you're going to learn French. If you went to Germany, you're going to learn Germany. If you stayed in Saudi, you're going to practice your English and in Arabic. If you went to Canadian, you're going to see a different culture. Do you want to see a different culture? You don't want to? Is your family status going to help you and support you? Is your finances okay with that? Would you rather stay with your close ones here in Saudi? So it's a really detailed based on you and your goals as a male or a female. So bear that in mind. The last thing I'm going to say, guys, please reach out if you need anything on social media. My emails are, I think you can share it with the people. And I'm very glad and honored to be among you here tonight. And thank you. I hope you got the best of this.
الله يسعدك دكتور صراحة يعني it was very informative يعني not only in the field of plastic surgery but overall, especially asking students to know if they're into medicine or surgery. فيعطيك ألف عافية وبإذن الله we will share your contacts مع on our Twitter account مع الحضور بإذن الله. الله يسعدك. شكرا جزيلا، شرف كبير لنا. الله يخليك.
مع السلامة. Thank you all. Bye bye.